Good morning, students. Today we will see about the nursing process. It is an orderly, systematic way of identifying the client's problem, making the plans to solve the problem, and initiate the plan of action to implement the action and evaluate the action and resolve the problem which is identified. That is called the nursing process. It is a systematic problem solving approach. If you see the steps of nursing process: assessment, nursing diagnosis, planning, implementation, and evaluation. What is called assessment? Assessment may be in a subjective or objective assessment. What is the meaning of assessment? Collecting, verifying, organizing the data about the client and his health status. So, if you see the process of assessment, identify the priority. If the patient is breathing difficulty, will you collect the data, history collection? Immediately do what is needed for to solve his basic need. When you are right, we will start collect. How will you collect? That's called method of data collection. So how will you collect? Observation, interview, examination. So these are all the major assessment technique. You will observe, interview, and examination. Okay, this assessment is what is assessment? This one is continuous update of the database information and analyze the data. What is the purpose of this one? The main purpose to determine the normal function of the client and to gather the information for his future, the past information being gathered in a form of a data. Organize the information according to the priority. Identify the health problem and identify the client's strength and weakness. Identify the need for the health teaching. What you have to teach them further. For example, if they are the diabetic client, he will be knowing better, but he may miss some of the point, like what kind of a slipper he has to wear it, or what kind of the food he will be knowing, and what is the importance of drugs, and what is the diabetic food care, maybe do not know. So footwear and food care will be your health teaching. So all these things you will be planned only by the better assessment. The next step in the nursing process is called the nursing diagnosis. Diagnosis is nothing but a clinical judgment about the individual, family, or community to the actual or the potential health problem is called the nursing diagnosis. Medical diagnosis different from the nursing diagnosis. What is the characteristic of nursing diagnosis? Nursing diagnosis should be clear and concise, specific and patient oriented. It related to the patient problem. It should be accurate. It is based on the reliable assessment. What is the assessment you are reliable? You correlate what is the subjective data, objective data, all these assessment, it should be correlated with each other. What is the purpose of nursing diagnosis? Same. To analyze and collect data, to identify the normal function level, to identify the client's strength and weakness, to formulate the diagnostic weakness. Understand? After diagnosing the nursing diagnosis, you will be planning. What planning? Planning is what to do in next minute or what to do in next second. It is called the planning. So planning is the development of nursing strategies to elevate the client's problem. The types of planning, maybe the initial planning will be immediately if the patient is having a breathing difficulties and immediate. Something will be ongoing planning. What exercise he has to do, what diet he has to follow throughout. It is an ongoing planning. Or what is the next nursing care, what you have to do it prevent the bed sore. And then one will be the discharge planning. So everything will be included the health teaching. And what are all the phases of planning? Setting the priorities, which is very important, and establish the goals and select the nursing interventions, write the nursing care plan. So purpose of planning. So give the direction to the client care activities, enhance the continuity of the care for the delegation of the specific activities. So that is the main purpose of nursing planning. So what is called implementation? Next step is called implementation. Implementation is nothing but the intervention to the nursing care activities. Whom you are intervening? To the patient. How you are intervening? You are intervening. What is the plan? The plan, how it is coming? According to the nursing diagnosis, it is coming. So this implementation, what are all the characteristics of implementation? Implementation based on the scientific principle. When you are giving a back care, which arm will be better, or which you are giving a bed bath, which further arm or nearer arm, or further arm, then only nearer arm. So every scientific principle has to be followed. Even the temperature checking and everything. Be individualized and clearly communicated. Be individualized and clearly communicated. Use the resources appropriately what is needed for the implementation. Give the safe and therapeutic environment. Main purpose of implementation to provide the technical nursing care, therapeutic nursing care client to achieve the optimal level of the health. Understand? If the patient implementation always, if the patient is able to walk, you have to implement the unique. It is so implementation is a unique. Bed bath may be your implementation. If that time you plan and the patient able to sit or can walk to the toilet, you can help or assist him. Right? So when the bathing is the implementation. So you have to always motivate the patients and involve in your patient care activities so that client will be doing independently in future. Evaluation. Evaluation is the final. The judgment of the effectiveness of nursing care. Okay. What is the evaluation? How the phases of evaluation? Review client goals, whether you achieved or not, collect the data, are you happy, patient satisfaction, measurement of the goal attainment, revision and modification of the care plan. Very important. Once the patient is better, you don't implement only bed bath or something. You can motivate them to bathroom bath, you can assist him. So the evaluation, once the evaluation will guide into the plan of action in next. What are you going to do? Purpose. Purpose is monitor of the quality of nursing care, how you have done to determine the outcome, to get the patient satisfaction, to compare the client response, what is his satisfaction, his response will be very good, means your care is very good, to identify the error in care, to prepare the nursing care plan. What is the current trend in nursing care plan? The nursing care plan before, if you see, only you study in the nursing schools and colleges. You may not write nursing care plan even you become a staff nurse. Now the AI applications, AI intervention, the computer application in the nursing care plan writing. The AI is supporting the nurse to develop the nursing care plan. That is the current trend in nursing care plan. Thank you.